Before I start the session, I'd like to have a quick audience poll. Can you please raise your hand if any one of you would like to be a millionaire? Some people. All right, I see some people are pretty interested. Okay. Now you can keep your hand up if you feel you have a plan to reach there. If you don't have a plan, you can bring your hand down. Okay, I see some hands up, some hands down. So for those of you who still have your hands up, because you have a plan in place, congratulations. Because now you have a plan in place, all what you need to do is the easy part, behavior change. Because we all know is the toughest part that all of us face. But having a plan is half the battle. Because many times we struggle with how do we even get there? If I want to do a weight loss, what are the steps for me to even do weight loss? So what I'm going to focus on is how can we utilize data to induce behavior change? But when we are talking about wellness programs, there are many stats that majority of our co-workers, our own employees, have asked for wellness programs to be put in place. Based on stats, 70%, which is 7 out of 10 of our co-workers have asked for these programs to be put in place. We all work hard. We all put in countless hours on weekends and weeknights, creating communication plan, IT plan, this plan, that plan, to roll these programs out. When we roll these programs out, what we find is only 9%, 10% people participate. There are exceptions, that's what we heard from guiding our health plans. But that's the biggest struggle. We have put in so much effort. We delivered something that people had asked us to deliver, then why are we not participating? So this is a big gap that we need to address. That's the first problem. The second problem is we all get so much fixated on outcomes. Outcomes are great, but let's stop for a second and let's focus on a much bigger challenge, participation. How can we increase participation and address this big gap of 70% people asking for wellness programs and only 9%, 10% using them? What I'm going to do is I'm going to share with you something that we have done. I'm not saying that's the only way, on how we have bridged the gap. And by the end of the session, I'm going to show you on how these 70% people who asked for a wellness solution, we were able to have around 60% of those people participate in what we are offering. So behavior change can be tracked at multiple levels. It's not just outcomes. The first behavior change is how can I have people participate? That means how can I make people take the first step to even enroll in the wellness program? Second is engagement. Once they have taken the first step, we talked about engagement this morning. How can we make sure they keep coming back? If I'm enrolled in a walking program, how can I make sure I'm walking week after week, month after month? If I'm doing weight loss, if I've lost weight, how can I ensure I can sustain that weight loss over a long period of time? And the last is the outcome. So we want to jump to outcome, but let's hold our horses. Let's focus on participation first. So I'm going to focus on participation for the next 15-20 minutes of this session. Before I go any further, let me share with you a little bit about what my role at NutriSaving is. One of my roles, the responsibility of NutriSaving, is primarily working with my clients, which is health plans, employers, or health systems, implement nutrition-focused wellness solutions. What does that really mean? So what we have realized is at NutriSavings is that nutrition is a key component of our well-being of employees and their families. So what we have done is we have built an ecosystem that connects our co-workers and their families, with the grocery stores of their choice. And the way this benefit works is once the connection is made between co-workers and their grocery stores, we start providing educational components to that. What is education? So that means whenever I'm going for grocery shopping, it can educate me on how to identify healthy food items. That's the first and foremost education. I want to eat healthy. I don't know what is healthy. Second is it can give me recommendations. If I buy something, you know what, we are all humans. If I buy something which is tasty but not healthy, it can give me recommendations of what exactly could be swapped out in future so I can change behavior. Second, it makes healthy food more affordable by giving incentives. these two levels working in tandem create an environment of motivation that employees can start working on their own, be independent, be autonomous as they change their own behavior. And the way this whole thing works together is we roll out this benefit to employers, health plans, or health systems, and after the employees receive the communication, they have an option to sign up either on the website or on the mobile app, and when they sign up, they are prompted to open their wallet. They open their wallet, take out their grocery rewards card, and type in the card number once. Or they take out their key fob, take out their key fob number from the grocery rewards card, type in the number once. And once they are typed in once, they are registered. Now, every time when they go for shopping, we get the data from the grocery store of what they bought. So this is an example of all the items I bought. I made up these items so they look healthy. So these are all the items that person bought, and we are providing nutritional score to all the food items. So we are making an employee and their family very educated. All the food items are given nutrition score between 0 and 100. Higher the score, healthier the item. So in this case, my shopping trip average healthy score was 73. So that was education component of that. The second part is how can I make healthy food more affordable by giving out incentives. There are multiple sources of incentive. In this example, I got some money from e-coupons that I can save. At the same time, I had an option to save money based on the plan design for my employer or my health plan, where I saved around $11 on this shopping trip. So that's what we do at Nutri7, just to kind of give you a context for that. So let's talk about the plan, because I said plan is half the battle. Let's share with you what we have learned so far. So as we are focusing on participation, participation does not start on the day we launch a program. Planning for participation, we have seen, usually start 3, 4, 5, 6 months prior to launching the program. So what we have seen is, typically when we roll out a benefit like Nutri-Savings, we need to really focus on participating for the first 6 months post-launch and prior to launch. Because after 6 months, unless we change the program plan design or create some new incentives or motivation, everything becomes stale. People go back to their normal ways of life. You know what, I'm hired to do a job, not to focus on my benefits. So it's very important to calculate that 6 months of time to actually have as much participation as we can. And then after 6 months, we shift gears to start focusing on engagement. The people who have participated, how can we make sure they can sustain the behavior? And one of the curves that we use, I'm sure many of you have seen this curve, is the bell-shaped curve for adoption, which is pretty industry standard curve that shows adoption of any new product, new technology, anything of that, including wellness offering, over a period of time. On the x-axis, you're seeing the time. That means as time goes by, number of people sign up increases. On the y-axis, you're seeing the number of people who have signed up. The way the bell curve shows is any new thing, we have a small number of people signing up, 2.5%, 3% people signing up for the innovators. And then these innovators translate into early adopters, you get more population. And if these two audiences like the service that we are offering, they become spokesperson for bringing on additional population. Along with this curve, we have also realized this straight line. Straight line denotes the amount of effort we need to expend to get more people signed up. So as time goes by, amount of effort we need to expend to get more people goes up significantly. So now if this is a challenge we are all facing, and if our goal is to have higher participation, we have two choices. One, shift the curve to the left as much as we can. Second, if I can push the curve up, I may have a higher participation. I'm going to share with you some of the metrics that we have used to shift the curve to the left and push the curve up. So what we have seen is participation depends upon many variables. You cannot really count them on even 2 hands. But 3 most important things that have popped up based on our experience of implementing different clients is communication, demographics, who your audience is in terms of male, female, your gender ratio, and the rewards. So let's talk about these elements. What we have seen is 2 more important things of communication that bubbled up to the top. One is the type of communication. Push versus pull. Push meaning when we are pushing information to Neil as email or as a text message. I'm calling Paul, asking him to sign up for the program. Pull is when we are putting posters and banners and flyers or even putting on the employee intranet and relying on the mercy of our employees to actually read the information and take action. So there are pros and cons for all of these types of things. So we have to have a balance of all of these options. So I'll take an example. So when we are talking of a pull communication, very effective to create awareness with the least amount of effort. We have worked with health plans of 20,000, 30,000 employees. We can create posters, banners, or put on the employee intranet. Almost everybody gets it. But the challenge is it's very hard or impossible to personalize that for every audience. That's number one challenge. Second, people don't think it's action item for them. So I've seen, I'm reading a poster, wow, you should eat healthy. I'm a healthy eater. Hey Paul, you should start eating healthy. I see another poster, start walking and start exercising. I'm fit. Hey, Neil, you should start exercising. So action item for somebody else because I'm perfect. People around me are not perfect. So it creates awareness, but lack of action items is the challenge. Push communication, whereas that is concerned, very personalized, very individualized, people can relate to it and they can take action. But in some cultures, it's very obtrusive that we need to kind of make sure we are aware of that. And then the frequency of communication. What I'm showing over here is, so we have taken data for several of our clients over the first 4 months from the day they went live and tried to isolate every other variable and just focus on communication. What you're seeing on the lowest line, which is the green line, are some of my clients where we did not have the option to do push communication because they didn't have email addresses, they didn't have phone numbers. So the only thing we could rely on was pull communication, which was great because least effort, maximum awareness. But when you look at the participation in the 4 months of time, you can see the numbers. The second line you're seeing in the middle are some of my clients where HR said, okay, you know what, it's painful for me to send out email to everybody else, it's very intrusive, but I'll do it once. They did it once, we got great success rate. The third example you're seeing, which is the topmost curve, where we took the message and personalized the message for every single employee based on the action they took either on the website or on the mobile app, number one. Number two, send a recurring reminder, depending on the frequency we want to choose. Similar message, different accounts, similar kind of incentive structure, the results you can see right here. Because people need to be reminded, not told, people need to be reminded so they can be nudged in the right direction. Because we don't know, what we heard from Neil this morning, is we don't know what is going on in their personal lives. So you have to keep reminding them. So when the right triggers, and the fog model, as Scott mentioned this morning, when all of the triggers combine together, that message may be more relevant to employees to start taking an action. That's one thing, critical thing that stood out from a communication standpoint. Next comes demographic that we felt had played a huge part in that. What we realized was it was way easier to engage female audience than male audience. So I heard the opposite this morning. I would love to know and learn more about that. But we have seen that female audience are more health conscious and they are buying grocery for their entire family usually, and everybody listens to them. And at the same time, many of my employees have actually asked, should we invest in mailers to home addresses? It's an expensive proposition. And what we have found out is, if the audience that we are dealing with in office is all male population, it pays off significantly. I'm going to show you some results in terms of investing in reaching out to spouses by mailers. So what you're going to see are the results. Again, similar set of clients, first 4 months after they go live. On the left-hand side, you're seeing male-dominated population. Similar incentives, similar communication, hard to engage unless we reach out to spouses. On the red line, you're seeing female employees, female-dominated employees, we were able to engage a lot easily. And on the right-hand side graph, you're seeing we were able to conduct some mailers, reaching out to the family members, 15-20% increase over the first 4 months of time of benefit rollout. Same benefit, similar kind of clients in terms of size, demographics, everything else, but different results. The last lever for participation that we talked about was rewards. We have seen many clients either offering no rewards for nutrition, you should eat healthy, there is no money for that, which is fine. And plus a wide spectrum of giving financial rewards or points-based rewards. The points-based rewards come into picture because many times NutriSavings is offered as a part of overall wellness strategy and embedded into the overall wellness platform that is offering points-based rewards. So you get reward points for buying healthy as well. And second is how much money is enough. We heard this morning it was free for doing biometrics, now it is 200, then it's 600, and we have also seen something similar. But at the same time, more money does not translate into more participation. We have seen the result. So what we are seeing here is, this is our experience, is financial rewards so far have won hands down in terms of increasing participation in the first 4 months of time. At the same time, what we've also seen is more dollar value or more number of points are not leading directly one-to-one in terms of increasing participation, because meaningful rewards for whatever activity we are doing are really driving the participation, not more money. So let me wrap this up and put this into a context. So this is what we said the goal we are shooting for in terms of adoption curve. So if this is the goal and we want to push the curve to the left and push the curve up, where we did only one-time communication, these are the results we got. What you're seeing as a yellow bar are the curve and the blue area are the results. We were not able to push the curve up. We were able to just push the curve a little bit to the left. When we are doing the same benefit to a different audience and doing recurring communications, you can see we were able to push the curve significantly to the left. Rather than 2.5% innovators, we were able to get 25-30% innovators and push the curve up as well. Similar audience, same approach, just we need to be more persistent. And I've taken the same clients and shown what exactly was the result over the 12-month period. As I showed you in the first slide, 70% people asked for it, 9% use it. We have reversed the trend in terms of 70% people asking for it, 61% people actually using it at the end of 12 months of time. Thank you.